When it comes to cerebral palsy, we talk mostly about management, because you find that it is a lifetime maybe condition.
Pearl Radio, the home of fresh and classic hits.
My names are Janet Nyongesa, and I'm a physiotherapist, and I do so many things, but basically I'm a physiotherapist, and I'm working with this organization called Koinonia Community. But basically under Koinonia Community, which has a lot of other programs that deals with maybe rehabilitation, empowerment of the vulnerable, but basically I'm working with a program that deals with children with disabilities, and commonly known as Paulos in Kibera, and we also have a program in Dagoretti, and also currently doing something in Kajiado County. Yes.
So you're doing a lot.
Sure, we are trying.
It's CP Awareness Month.
Yes, it's CP Awareness Month.
And before we get into, understanding what this month in Abeba Nini, I just want us to, understand what is CP, Cerebral Palsy.
Cerebral Palsy, yes. And also in this awareness, green is the color. Green and
that's
white.
why you have green?
Yeah. What is cerebral palsy? So cerebral palsy is a condition, developmental condition. And when we're talking about developmental condition, basically it means that this is a condition that affects mainly children while they are still developing. So this means that me and you cannot get CP at this point. So this means that, and from the words cerebral palsy itself, it comes, the word cerebral, if you remember, siju kama ulifanya biology, it comes from the word cerebrum. Cerebra, I know. So cerebrum definitely, in other words, means the brain, and palsy, in other words, would mean paralysis. So palsy, so cerebral palsy basically means there is a damage to the brain, and especially when children are developing, that causes or rather interferes with general movement of children and general posture, movement, coordination. So this means when you're talking about development, it means that this would affect the child when the mother is still pregnant, or a child would have cerebral palsy maybe when during delivery, when the mother is delivering, or just some few years, maybe 3 years, 1 to 3 years after delivery. So that means that the child was just born okay, but then they became sick, maybe like with diseases like meningitis, so the brain was affected, and then it interfered with the normal development. So generally what cerebral palsy means, it's that one, the brain has been damaged, and it's a brain of a child who was either developing while the mother was pregnant, if not while the child was being given birth to, or just some few years immediately after birth. So and this damage interferes with the normal development of the brain, because unajua mtoto akizaliwa, when they start growing, sasa the brain is also developing. That's why they are at some months they should be sitting, crawling, standing, then walking. It's because the brain is developing, and so those muscles and different organs in the body are also developing and doing their functions. So this means that the damage causes or rather interferes with that normal development. So it means that this child, they will be born, but they will have maybe some weaknesses of muscles. Kama anafaa kukaa 6 months, they will not achieve that at 6 months, or whatever months. At 1 year, they have not achieved. So it means that even other parts of the body organs are affected. Because the brain is like a car engine. So it plays so very key roles in our body. So you find that maybe there's a child, depending on the severity and also the part of the brain that was damaged, that maybe the child will not be able to see well, or will have issues, vision, issues of hearing, issues, speech, and generally muscles, because at the end of the day muscles are affected, but not even muscles alone. There's the aspect of the brain that deals with intellectual capacity, memory, and all that, because the cerebrum, looking at the functions of the cerebrum, it plays those key roles, apart from just coordinating muscles, strength, coordination, what we call sometimes tone, posture, and all that. There's the aspect of other what we call cognitive development, meaning cognitive development is much about issues, maybe intelligence, how to learn, memorize, think, thought processes and all that. So this means this child will not have the normal, let me put in quotes, normal development like the other child. So maybe amefika 1.5 years, 2 years, 3 years, they're not able to sit, not able to walk, not able to do a lot of things. But also severity differs.
Okay.
Yes.
And I want to ask you, because you've mentioned that it can occur when the child is growing about 3 years. Hapa kwa akiwa kwa womb, and during delivery, like what would happen if the child is in the womb? Is there a thing that a mother would do alafu ilete hiyo condition?
Sure. There could be, although not very maybe common at this point, but the other causes that we call, so that one we say that is causes related to before delivery, and that's why we advise mothers that when you're pregnant, just go for prenatal clinics, because there could be issues. And one of the things that we are told when you're pregnant is that, for example, you should not bleed. If you see a spotting bleeding, you're supposed to go back to the hospital so that they try to understand what is the cause. It could also be some kind of injury. Maybe ulipata tu injury and then uka-assume you start bleeding, because unajua when mtoto akiwa kwa tumbo, especially the first 3 months, we say the first 3 months after conception, that's when the brain is that's where the nervous system is the brain and the spinal cord. So that's when the nervous system is developing. So this means that if there is something quite of an interference, especially during the first months, then it interferes with the normal development of the brain. So this means that there could be maybe accident generally, but then there could be also infections. Years back we were talking about HIV, but these days technology and medicine has really improved and all that. These days is what we call prevention of mother to child transmission. So you could be HIV positive and you still get treatment, and then the child you get birth, the child that is born is not infected and all that, but there could be some kind of whatever infections, even if not necessarily related to HIV. There could, what is commonly also known is the issue of a condition or a disease called measles, but it's called German measles. So it's possible that measles mostly affect us when we are young, but ukipatikana bahati mbaya you get measles when you're pregnant, but a specific kind of measles called German measles, those kind of infections would interfere with the normal development of the brain while the child is still in the mother's womb. Talking about during birth.
Yes, during birth.
It is the most common cause of cerebral palsy. Those issues that are related to when the mother is delivering, starting with number 1, what we call prolonged labor.
What?
Prolonged labor. So prolonged labor ni ile yenye, we always have this kind of range of, like when you're pregnant, you want to give birth, maybe you're not supposed to labor more than maybe 8, 10, 12 hours. So okay, there are people who would labor maybe 2 hours, 3 hours, wanajifungua, okay, they're fine, but there's somebody who would also labor for 10 hours, maybe they're okay, but normally there's this kind of range. So for me, at a personal level, I'm not saying that maybe this is whatever, because there are few people who have labored maybe for more than 10 hours na wakapata watoto wakakuwa sawa. But then for me, I always say, speaking to the kind of people that we work with, normally I tell them that ukifika 8 hours you have labored, and this means that maybe the contractions started, because labor means that the contractions are there, so this child is really pushing, they want to exit, it's the time to come out. So this means that at least wejipe 8 hours. Ikifika 8 hours after, then just know that it's like you're entering the danger zone. So this means that emergency cesarean section is recommended. The challenge is we are dealing with the people who maybe they are not informed that maybe prolonged labor, number 1, would cause is an issue. So maybe you didn't plan well about the delivery, and so you went just in and you are not sure, maybe an emergency would occur, something would occur. You didn't plan also to have prolonged labor. So just go in a facility that is not well equipped, maybe even with the personnel facilities, and then inakuwa prolonged, and then it happens that you need to go for emergency CS sasa hapo ndio inabidi ambulance ianze kutafuta upeleko Kenyatta. By the time you are reaching Kenyatta, already mtoto amechoka. Sasa that's what you hear, that tunaambiwanga mtoto amechoka. So mtoto kuchoka means oxygen not reach well the brain, so what we call birth asphyxia. So it is very common. Why? Because people don't know, and sometimes una labor, and in fact the cases we are dealing with, most of the time you find that unasikia mtu anakuambia I started laboring jana, but it was on off, mwingine hata juzi 3 days. So hiyo is already risky. Mwingine hata alianza kuleba hivyo, the what we call amniotic fluid, there's that fluid, the environment that the child is, so you find that ilipasuka,
and they didn't go to hospital.
Yes, they didn't go to hospital, and you know that already is because that environment is what keeps the baby there. So after that, it's an issue.
So what other thing causes
yes, so apart from prolonged labor, just talking around the same at birth, there is what we call breech presentation, malpresentation. This means normally mtoto akizaliwa they supposed to present with their head first. So the head comes first, but there are cases where this child did not turn, and this is because of also would be the weight of the child, or that the child just did not turn, because ikifika week fulani around maybe between 24 to around maybe 32 weeks, huyo mtoto vile alikuwa amelala kwenye tumbo, they're supposed to at least turn their head facing downwards. So meaning that they are supposed to be coming out in the next few weeks. So you find that the other children maybe at 32, 34 weeks they have not turned. So this means that weight, because you see they're also growing, the weight is increasing. Womb, it reaches a place whereby if the baby is too big and they have not turned earlier enough, then inakuwa vigumu for them to turn. So it means wakati wa kujifungua they will come with either the shoulder, the leg, limbs. So this means that it's very dangerous. And in such cases emergency cesarean section is recommended. But we always say it is very important for you to do an ultrasound scan when you are pregnant, at least 2-3 scans, because especially after maybe 33, 34 weeks, 35 weeks, it's also important to do one, because you will just know that maybe this child amegeuka, so we are good. But if not, then you start thinking of what we call elective cesarean section. Elective is planned for. Cesarean section that is planned for. So this means that at least when you have done a scan, it's good that it can be planned for, and so by the time you are going to give birth, haitakuwa ni emergency, daktari anaanza kufanya kazi yake, and then they say, this child is presenting with a leg instead of the head, and then it becomes, now it's emergency, we have to rush. By the time those all processes are happening, always kunakuwa already damage imefanyika.
What else can cause CP?
Yes, at birth, what can also cause CP is what we call maybe cord around the neck. Cord around the neck means the umbilical cord. The child, while still in the mother's womb, the cord goes around their necks. Then it's not always an issue when the mother is still pregnant, the child is still in the womb. But now the challenge comes when they are now delivering, because when the mother is delivering, the time she's pushing, it's like she's strangling the baby. The more she pushes, so extreme case is whereby it causes a stillbirth. Stillbirth meaning the child dies. But then if the child does not die, it means that there is the limited oxygen reaching the brain, and so the child will have what you call cerebral palsy. But it's good to do an ultrasound scan, as I said, because normally in such a case you would see that the cord is around the neck. So doctors will start planning that, okay, now this will not go for normal delivery. There are a few cases in such cases they were successful. They got an expert who was able to assist well and remove the cord and the child, but it's always a risk. Then lastly, on the same, there are other causes that I would just say on the same, I would call maybe risk factors. The risk factors like not necessarily direct causes, but risk factors, for example, prematurity, meaning that this child did not reach term. And it could be because of so many other reasons. High blood pressure these days is very common. It could be because of whatever reason, some kind of illness, or rather the mother has a weak cervix, they're not able to sustain pregnancy to term, such like, or maybe what we call multiple births. Multiple births mean that you are going to deliver not one baby, you're going to deliver maybe 2, 3, 4 babies. So you are at a higher risk. You've had cases of where mama alijifungua watoto wanne wote wakakufa, because once you're getting 3 children, it means they're not all the same. Kuna ule ali struggle akapata enough nutrients, they developed well, but kuna ule mwenye kiasi alinyimwa kabisa, and they could have not developed well, including their brain. So such cases, that's why unapatana kwa very underweight, because weight could also be a risk factor to CP. So there are such like factors in relation to, also related to maybe at birth, and generally after birth. It's commonly diseases like maybe meningitis is very common, also, or an accident. Mtoto anaweza anguka kutoka ghorofa, agonge kichwa, they get some head injury. So if they are still young, brain yet develop vile inafaa, so that's cerebral palsy. It's that the muscles are very stiff. Looking maybe if you try to do a movement at the elbow joint, for example, there is resisting of movement because there is stiffness at the, just in simple terms, the muscle, what we say, the muscle tone is very high. The tone of muscle is higher, what we call hypertonic. So something like stiffness. So basically this is one type that is very, very, very common. So generally you see the child presenting with stiffness anytime, like now the therapists, when they're doing the movements, they find that they at maybe the knee joint, elbow joint, there is resisting of movement because of that stiffness, and this depends because of where the brain was damaged. That is one. Number 2, we talk about what I call ataxic cerebral palsy. Ataxic is basically, there's a part of the brain called cerebellum, which mostly deals with coordination and balance, somebody's coordination and balance. So when that part of the brain is affected, then you find that this child will get what we call ataxic cerebral palsy, which is characterized mostly by poor balance and coordination. So mtoto, they would be given birth to, but because of some weakness of muscles, because also now their muscles are not now hypertonic, because I said hyper is increased tone, but now in this case maybe slightly hypo meaning ni extremely little bit relaxed, beyond normal, and so watakuwa na shida ya balance and coordination. So this means that even when you train them, they are improving, but then hata wakati wa kutembea, there's a big issue with balance, walking hata kwa stairs, or even walking, they would walk with what we call as ataxic gait, like their legs quite very wide apart, because they're the brain is trying to seek some balance. That is ataxic. Number 3, what we call athetoid cerebral palsy, and athetoid is also very common in relation to what we call, if a child had something called neonatal jaundice. Jaundice, and I know most people know what jaundice is. Jaundice basically means yellowing of the skin, nails, eyes, but in that case you find that a child is born and then they have jaundice, so machos nakuwa yellow, fingers yellow, and all that. So it's commonly related to that, and this one, jaundice, you'll find that it's mostly in children who are born also prematurely, because the liver has not developed enough to be able to do its function, and so you find that there is that the breakdown of that element called bilirubin is not there, so there is excess production, the liver is not mature enough to break down that. So we find that they get what we call athetoid. So in athetoid, mostly unapata the child will present with, of course, weaknesses, of course all of them delayed milestones. They're supposed to be sitting, standing, of course they have not achieved all that. And so, but specifically for these, find that the muscles are quite involuntary when they're trying to lift their hand, for example, inaenda nyuma, something like that. So that is the presentation. And then number 4, we have what we call hypotonic. Hypo now is like almost the opposite of spastic, because we said spastic is hyper. Now in the case of hypo, like the muscles are overly relaxed, extremely weak, if I can say that. The tone is extremely it's very floppy, if I can say. So that is called hypotonic. And then lastly, what we call mixed cerebral palsy. So mixed is now a mixture. You find there is a child, maybe you assess, like it's not like athetoid, it's not ataxic, anorexic, it's not maybe spastic, so they have a mixture of all that. So you could confuse it with spastic, but it's not spastic. Maybe sometimes they're very hypo, so it is a mixture of all that. And as I said, all this depends, number one, with the part of the brain that was damaged, and also the presentation also depends with the severity of damage. So in fact, in terms of cerebral palsy, this is how we categorize the severity. Severity starts from profound. Profound, it means like completely, it's very severe in such a way that they are very dependent on the caregiver. Maybe others, they are not even, their eyes have been affected, they're not able to see. Others, they're not able to hear, not able to speak, hold something with their hands, the hands, they're not oriented in the environment. So you're in profound, very severe case. Now all the limbs are also affected, all the legs, hands, all are affected, So, and then now this profound, there is now what we call severe, moderate, or mild. So all presentation and what we would call prognosis, or rather in terms of the presentation at the end of the day after rehabilitation, that is exercise and all other activities, services that they are provided with, depends mostly with the severity. So you find that maybe the mild one or moderate, the others will try and improve and walk. Yeah.
Do we have treatment options for this particular condition?
Yes. Now, when it comes to cerebral palsy, we talk mostly about management, because you find that it is a lifetime maybe condition. Once you have cerebral palsy, what can only happen is that, of course, there is improvement in those milestones. And as I mentioned earlier on, of course, children with cerebral palsy, what happens is that they have delayed milestones. They're supposed to be sitting, walking, standing, they delay. So you find that with rehabilitation, maybe some of them would improve. Of course, most of them improve. But then depending on the severity of the case, now it at the end of the day depends that maybe the other one is able to achieve walking milestone, another one is not able to achieve walking milestone, but they can achieve sitting milestone and all that. So there's always a possibility of improvement because of the management. And when we're talking about management, we are talking about early intervention. There are services we call early intervention services. And number one, talking of rehabilitation services. Rehabilitation services are now like us, the physiotherapists, occupational therapists. There's what we call maybe the orthopedic technicians who are able to, the other children as they are growing now, because these are people who are also growing. Maybe they will require some assistive devices. Maybe their hand is not well positioned, so they need some device to put on the hand for them to function well, to do activities of daily living well, or rather the leg has some limitation that maybe they need to be made for a special device to assist them by, So what I would say is that early intervention means that we are intervening in this case early enough. So meaning that a child who comes maybe for rehabilitation services or goes for rehabilitation services, that is therapy, occupational physio or whatever, early enough, they have a good prognosis, meaning that the improvement is very good at the end of the day. So talking about management, generally we talk about early intervention, meaning that it is good to create awareness, because if you know that you have a child with cerebral palsy, it's important to seek the attention of the doctors or these therapists so that we start helping the child with those exercises and so many other things when they are still young and young enough, maybe 1 year or below 1 year, depending on, it is unlike somebody who would come maybe starting to seek services at 10 years. So number one, as we are saying, rehabilitation services, but we also talk about, and we there is what we call speech therapy services, which I know people know, of course. They're not very common because only starting a few years ago, Kenya started training speech therapists, and you find that most of these children, they have issues with speech. There's a part of the brain that deals with the speech and language that has been affected. So speech therapy services are important also for the child. There's the aspect of nutrition. Why? Because there are other children, because of their condition, they're struggling with feeding, they're underweight, so it is quite a struggle. Nutrition services. There's what apart from nutrition services, we would say we'll talk about medication. cerebral palsy also, many children, they have what we call conversions or seizures. I don't know how it's mentioned, seizures or
seizures. Yes.
So you find that there are others who need to be on medication full time. Otherwise, if they are not using medication, they are conversing. It means the brain is sending impulses at a rate that is not good, and so they converse, and conversions are not good, because anytime a child gets conversion, any episode, it's like it's bringing more damage to the brain, or rather it causes it interferes with the normal development, or rather the improvement that we could have achieved as therapy. So medication and all that. So normally management and what I would not necessarily call maybe treatment, but management is mostly about rehabilitation, and then about other services like nutrition program, depending on whether the child has issues, feeding issues, because of the muscles are weak. Some of them are always having problems chewing. They have problems, generally feeding, because muscles kuanzia za ndani, internal, external muscles are weak, so they're affected. So nutrition, speech therapy services, generally medication, and then apart from that, most important now, that treatment is when we want them to be accommodated in the community. Now that's what we call inclusion. Yes, we'll talk about that.
And now when you say in management, you mean that at no point will we say tumetibu mtoto ambaye tumejaribu kumanage, it's completely done.
So it's not like malaria. We'll say you're gonna malaria, so you get this medication and so you are well. When you get treatment for malaria, you get the doctor prescribes the medication, and maybe after a period of time you're completely well. So in this case, we talk about management. Why? When we are discussing cerebral palsy, we say it's damage to the brain that it's not permanent, but it's non-progressive. It's non-progressive, but it's not going to improve. Like as long as the damage has happened, it's not reversible. But then it's not progressing, like the damage doesn't continue to increase. So it's like a permanent damage, because it's not reversible. There's no way you're going to say that now the brain is going to reverse, and so mtoto atakuwa sawa, and like they'll start now catch up like the other children who are developing normally, or rather in quotes. The word normal is always not very good, so that's why I'm putting in quotes. So basically that's why we're using management, because it's just about adaptations and accommodations in the community. So that's why it is preferable to use management than treatment.
Are the myths about CP and the misconceptions? Can you talk about that?
Yes. So talking about myths and misconceptions, there have been, or rather there are quite a number, but at least as years have gone, institutions, including us, we have really created awareness on the same, and so somehow at least people are having knowledge and the understanding that maybe cerebral palsy, or rather disability, is not related to what people really thought was. So for example, one of the myths is that people would think that it is contagious, but CP is not contagious. It's not contagious, as we have already heard about what causes CP. So, and it's not like when you associate yourself with a person who has cerebral palsy, a child with a cerebral palsy, you will get CP. And in some years back, that was really common. People would tell you, especially some of us who started working young, very young, and we didn't have children. People thought, and people would think, or rather tell you that, now associating with these mothers, caregivers who have children with disability and maybe specifically cerebral palsy, you would get a child with cerebral palsy. No, it's not contagious. People have also thought that it is witchcraft, but it's not witchcraft. But until now, there are people who still think that it's witchcraft. We still get so many stories from these caregivers, and you find that these are the mothers of these children. You find that some of them, from even their families or even the community, they think that it's witchcraft. Somebody did something, somebody who didn't like them or something. So they really think it's witchcraft. Some some other people think it's a curse. It's a curse, from something. And the challenge with these misconceptions and myths, always somebody would find even a backup, like they have some kind of evidence that it is true. So they would always give stories in relation to that. And the bad thing with that is that because of these, if people don't know they don't have the right information about that, they will stigmatize you, they will isolate you, they'll separate you from the community. They'll be looking at you like, this woman who did this, so there's such like a misconception and myths, like I've said. But basically, we know if we have the knowledge, then we know how best we can support these people. We can support children with disability, we can support their families, and we can also be used as agents to even educate the community and just raise awareness on the same and just embrace such families and also people with this condition.
Okay. I want us to answer some questions that we have in studio from the listeners. And someone says, hi, Pal Radio. Kindly ask our guest if this particular condition, that is cerebral palsy, is permanent. So this is from a listener.
Yes. So basically, cerebral palsy, as we say, it is permanent damage of the brain. I don't want to say the condition is permanent because the presentation with rehabilitation and the services that I mentioned, the presentation always improves. But the damage that has already occurred is permanent, meaning that it is irreversible. You cannot change. And I said it is irreversible and permanent because, as I mentioned earlier on, it is affecting a child. The child whose brain had not started, or rather was to start developing after birth, or rather was in the process of developing. So it had not reached maturity in terms of development. It's not like my brain and your brain as adults. Our brains have already matured, if we can say, in development. So for a child, they still, when they are born or when they're still in the mother's womb, they're supposed to get born and then the brain continues to develop. So now we say it's permanent. It's a permanent damage to the brain because of that situation. But then there is a way the brain itself, regardless of the fact that it's permanent, it is able to adapt in such a way that when now we are able to offer these services, like it bridges that gap. There is the capacity of the brain to bridge the gap of the damage, and because of the services, as I mentioned, therapy services, you find that now the child is still able to improve. So you find that most of these children, depending on the severity of the case, they continue to improve. So there's this child who maybe they are not able to sit by 8 months, but when you continue with the therapy and other aspects of supporting them, you find that they continue to improve. But the challenge is, remember, there is delayed milestones, delayed developmental, meaning that this child will not now catch up to start sitting at the right time. They will delay in many aspects of their life. They will not maybe be exactly the same as this other child, but then they will be somebody in the community. They will do something based on their capacity. Their capacity is just a little bit different from the other, but also it also depends with the severity of the case, because it means that we have this kind of very severe case that maybe, yes, they would improve, but maybe the improvement would not be very profound. But then, so what I'm saying is, we talk about brain damage that is permanent, and because it has interfered with the normal development of the brain, the child was still the child's brain was still developing, and so it means the presentation in terms of the functions of the body in terms of muscles and whatever all those body organs were to do, slightly there will be a delay, or if it's very profound, maybe not really be able to do the functions as maybe in another
compared
child.
To another child. Another question someone asks, if a grown-up can't get cerebral palsy, so can a grown-up get this particular condition, CP? No. So when you're talking about cerebral palsy, it's specifically for children. As I said, when the mother is still pregnant at birth, or the early years of the child, this could be maybe 2, 3, maybe 4 years, we could talk about that is cerebral palsy. So when we're talking about an adult, there's so many other, what I would say, neurological conditions that affect an adult, but it's not CP. Because remember, for it is called CP
be because the brain got a damage when it had not matured.
It had not developed.
Yes, to maturity. But for an adult, your brain has already matured. So there are so many other neurological conditions that an adult can get. Neurological conditions meaning that the brain has been affected, nerves have been affected, maybe the spinal cord has been affected. So that is a category of neurological conditions. And these would affect a person to present maybe the same, because at the end of the day, the brain of a child, the brain of an adult, of course, they have similar functions. So we find the presentation would be maybe the same as, because there is weakness of muscles, for example, depending on a case. Let me use a case like somebody gets maybe a stroke. I know many people know stroke.
Yes.
It's a neurological condition. The whichever part of the brain, either the left cerebrum or the right cerebrum, is affected because of some risk factors like maybe high blood pressure and the likes. And so there is what we call an accident that happens in the brain, what we call CVA. CVA is cerebrovascular accident, CVA. So it means there is a clot, because cerebral, as you already said, is brain. Vascular is related to blood and the transportation of blood in the body, and it's an accident. So it means that maybe the blood, because of whatever reason, there's a clot in the brain, and so those vessels that transport blood to the brain, they supply the brain, maybe they are blocked because of this accident, because the accident would happen, and if the accident is happening in the brain, the blood will clot and it forms a blockage, and then somebody gets maybe stroke. The presentation is hemiparesis or hemiplegia. Hemi is meaning they are paralyzed one side of the body, and if it is the right side, normally we say the brain, if it's the right side, it means the left opposite side of the brain is affected, and vice versa. So if you see somebody with a left hemi, weakness of one side, maybe it's left, it means the right side of the brain is affected, the right side of the cerebrum is affected. And then apart from that, it could be meningitis. Meningitis also, apart from it affecting children, adults get meningitis, and you get neurological conditions. So neurological conditions, it means it's related to the brain, as I said.
But it's presenting like cerebral palsy.
Yeah, because of course you will maybe go in coma, you get weakness of the muscles, you're not walking, speech is affected, because I said the brain functions are the same in child and in an adult. The only difference is cerebral palsy in child, because they have not the brain has not developed. But that does not mean in children there are also other conditions that are not cerebral palsy, but they could be related to maybe the brain and also maybe the spinal cord. But specifically in this case, it's cerebral palsy. And cerebral palsy, especially when you need to know well, based on those factors I said, before birth, at birth, after birth. The first thing we always also ask the parents is that when you're giving birth, for example, did your child cry immediately after birth? It's very key. Very key. So for those children who the issue is not after birth, because after birth inamaanisha yeye alikuwa amezaliwa vizuri, maybe they got the disease meningitis, lakini for mwenye hakukuwa sawa hiyo time, ask, did the child cry immediately? Because if they didn't cry immediately after birth, it means oxygen not reach the brain immediately, so they had what we call birth asphyxia. So brain was not oxygen was not immediately supplied to the brain. Yeah, so that's why unasikia mtoto akizaliwa lazima alie immediately. So that is one key important thing that you need to know when you are also doing an assessment for CP.
96.9 FM, Pearl Radio.